In today's episode, I am joined by Brandon, a doctor of physical therapy with a focus in applied neurology. Brandon has 20 years' experience as a personal trainer, 10 years as an Olympic weightlifting coach, and 4 years as a physical therapist. Brandon is the owner of School of Movement Physical Therapy, and you can find his website at schoolofmovementpt.com, or you can find him on Instagram at schoolofmovementpt. Brandon has found one of his passions in applied neurology, and it's a different perspective I'm excited to share with you all. So let's get started and see if we can build some insight today. All right, welcome, Brandon.
Hey, Anna.
So this podcast is all about insight, about anything and everything, and you have a ton of insight to give about the body.
I think so. I like to think so. I try to stay humble about it. So thank you.
Well, I've talked to you a little bit here and there, and I can definitely say that you know quite a bit about the body and you're very passionate about this work. And I am just so grateful that you decided to join this podcast today.
Thank you. Thank you for having me. I'm excited to talk it out with you, especially to hear kind of how your thoughts are with what you do and how kind of that maybe compares and contrasts. So
Yeah, I
thanks for having me.
think I think there's going to be a little bit of overlap, so I'm excited to see where this goes today.
Cool.
And starting out, I really want to get to know your journey into doing what you do. I know you chose physical therapy, but where did that choice come from? How did you find it?
So question. I think I was maybe about somewhere around 8 years into my personal training career. And in training, I was kind of hitting a fork in the road. Is this what I love? I feel like there's got to be more to this. I don't really love the sales aspect. I really like the helping people aspect.
Mhm.
And at that same time, I happened to get a lot of clients that either had, major injuries or they had something like Parkinson's, something that you're just not really taught as a trainer, whether it's, on the job training or it's through certification work. They really don't teach you much about that. So I got more and more and more people like that. And, kind of being at that fork in the road, what's best for me, along with how do I best help these people? That's really what led me to PT, to physical therapy. um, all the research I dove into, and kind of this one guy, Kelly Starrett, he's a kind of a CrossFit guy, but also a physical therapist. His teachings show you how to take care of your own body. Like what bands and balls and tools can you use to, loosen up joint capsules and get those muscles to work together better. Whether you're sore, whether you're having pain. So all these things just kind of fell into my lap or hit me at the same time. And it just naturally led me to physical therapy because I felt like it was a career where I could learn to master the body and help the most people.
Hmm. Were there any other paths that you were considering at the time, or was PT kind of the only option?
Yeah. The other path was opening up maybe a CrossFit gym.
Hmm.
It's not so much that I was into CrossFit. I like the components of it, but I knew that, CrossFit was super big at the time and it was the easy draw. People knew what it was. They wanted to push themselves like that. And I was happy to push them in that same direction. But it was more like, okay, if I'm gonna stay a trainer, how can I make this my own, but while I build a community? So I thought CrossFit would do that for me. And funny enough, I actually went down that path first. My dad
Hmm.
had a friend who was an investor. So things were all kind of set up. I wrote the business plan, kind of talked this out with everybody, A to Z.
Yeah.
And then at the last minute, the investor pulled out.
Oh.
Yeah. So it was more that he just didn't have the funds like he thought he did. So I, being my somewhat impatient self, scrapped it and said, let's go PT school. So I literally just veered left. I haven't looked back since.
I was gonna say that's such an interesting thing that it almost happened,
Yeah,
and just how different your life might have been had you just opened a CrossFit gym.
completely.
I feel like there'd be a lot less understanding of those mechanics in the
Mhm.
way that you understand it now. And with this postural restoration stuff, maybe that neurological side as well.
Yeah, totally would have been left on the table. Totally.
Yeah. So I know a couple other PTs, as you know, and most of them are very anti-neurological. They're like, I don't want to deal with neurological issues. I'm not interested in that. I want to do this kind of stuff. And you kind of went in the other direction. So
Mhm.
I'm curious where that interest came from for you.
Okay. That's a good question. I feel like with conventional physical therapy, that's how I would describe most PTs. They do conventional physical therapy. I think that the tools you learn both in school and while practicing, are very, very valuable. And I find that those tools work best when people only have one ailment. I find it to work best when that ailment itself is not that severe.
Okay.
Um, as best as I can combine the education I've had in training with conventional physical therapy, there is a lot of time that you help these people out of pain. And then, whatever time period goes by, they wind up in the same pain. So
Mm.
what drew me to neurological stuff was I had a somewhat deeper understanding of how the body was driven by the brain. And when you work with neurological patients, they have a bigger disconnect in their body and brain connection. So for me, it was how do I figure out how to help these people connect parts of their body, not just one at a time, like you do in conventional physical therapy, but how do I get everything to just connect on the spot and go to both eliminate their pains, give them a sense of ownership of their body, but to also get their brain itself calmed down. It's kind of hard for the brain to feel like it can function when it doesn't even know where its own body is.
So, in realizing that that is something you could learn, did you just research and happen upon this certification you got, or did someone else lead you there?
So there was a couple things. Before, when I got into PT school, I actually had to redo my undergrad. So my first undergrad was in film production. Just always been attracted to film and my skating back.
Really?
Yeah. So I
Huh.
went to the Institute of Atlanta, studied film for a while because I've been doing film since I was 12. I just love the artistic side of how do I film something, but then put a spin on it that draws you in even more.
That is so cool. I never knew that about you.
Thank you. So yeah, so hopefully we can work some of that back into some of my PT stuff. But
Hmm.
when I finished undergrad the second time and I studied kinesiology, I
Okay.
had gotten accepted to PT school, and a friend of mine did the first PRI certification. So PRI is Postural Restoration Institute. And even
Hmm.
though it talks about posture and the name posture is in the title, it's very much applied neurology, right? So you're understanding how the brain works, understanding how the brain drives the body, um, and posture is a component of it. So my friend, he did the first certification, and he used me as his guinea pig. So he tested me, he treated me,
Mm-hmm.
and the biggest draw was that as a trainer, my focus was on diaphragmatic breathing, or so I thought.
Hmm.
What I thought was diaphragmatic breathing was actually belly breathing. And I want to
Hmm.
clarify that belly breathing is not good. Belly breathing is not correct. There's a time and a place for it, but it's a very, very specific thing that so few people would need. It doesn't even make sense to explain.
Okay.
So, what I thought was diaphragmatic breathing, my friend, when he tested me, he actually had me blow up a balloon and I couldn't blow it up. So if I'm sitting there as a trainer, now at this point for what was 12 years now, thinking I can breathe, thinking I can coordinate my breathing with difficult movement patterns, and I can't even blow up a balloon, there's something to this. So that was the first spark of what kind of led me to PRI, which again is neurology.
Hmm.
But then when I was in undergrad, I actually took, I forgot what the course was called. I think it was just neuroscience. So I took courses in neuroscience, and you go through that, you see what you're missing. So that in itself drew me in. I was just hooked right away.
Yeah.
So
Okay. And I know you kind of talked about this a little bit of that spark and what kind of made you interested in it. But as you started getting the experience on the ground doing the work, what's made you passionate about it?
honestly, it's that light bulb. When you share something with someone and they were just missing that one thing, something that was limiting them from feeling no pain or feeling connected in their body, or just feeling like their body can quiet down. When that light bulb goes off, I can't explain. It just excites me so much that I'm sometimes I'm almost happier than the person is, because I like that they got to sense
Yeah.
what I sense. I think that's what it really comes back to is I feel like I've trained my body to connect so well and to be so quiet and to perform and under such demanding settings and still be quiet and still be pain free that I like to share that with people. And hearing people say, "Oh, I have pain with this activity," which may be something as so little as climbing stairs. And I'm over here throwing around a couple 100 pounds. I got to be able to help you. You got to be able to walk upstairs without pain. So,
Mhm. I
as an
love
example,
that answer so much because that's what this podcast is about, is that light bulb moment, that insight of, oh, this is the piece that I was missing that I need to take to better my life, to be more effective, more efficient.
Exactly. And sometimes it's just one thing and then everything opens up, you know?
Hmm. I do a lot of, I mean, a lot of breath work in my practice, a lot of mindfulness and trying to notice the body cues. And there's this one piece that I do with chronic pain that I'm really curious what your perspective is on it, because we often, or I often teach, and I was taught by supervisors to talk about the pain itself is not the problem. The
Mm-hmm.
pain, it's your alarm system going off. The pain itself is not doing the harm. It is your body's way of telling you there is something that is doing harm or potentially doing harm that you need to pay attention to.
100%. Yeah. So your body, it has all these nerves and each nerve has a different job. I'm not sure how much neuroscience or neuroanatomy that they went into with you, but with us, you have a nerve for vibration. So if you use that massage gun and it feels really good, that nerve is being stimulated, sensing the vibration.
Mhm.
I'm gonna come back to this in just a second, but you have a pain nerve, you have a cold nerve, a hot nerve, you have a touch nerve, et cetera, et cetera, et cetera. Well, the pain nerve is the smallest, thinnest nerve. So when you activate these other nerves, so if someone massages you, that touch nerve, there's also a pressure nerve for massage that's stimulated. Well, all these nerves are thicker and bigger. So if you have pain and then you use an external stimulus that supersedes the pain nerve, it quiets the pain. So yeah, it's 100%. It's
Interesting.
not so much the pain site. It's just a matter of a structure that's communicating information to your brain, letting you know the site is experiencing something that's usually too much tension. It's being pulled on too much, or it's got too much compression. It's being smushed too much.
Okay.
So that's what stimulates that pain nerve.
Yeah. And from kind of the mental side of that, then, because we as humans, we want to avoid pain. And instead of seeing it as an alarm bell, I notice a lot of people see it as, oh, this is wrong. And so, they medicate or do whatever they can to make the pain go away, thinking that if the pain goes away, that fixes the problem. But that isn't necessarily the case.
Right. And it sucks too. We don't have to go crazy into the physiology, but you take medication. So that might dampen the pain nerve. But
Mm,
you could, again, it depends on the actual injury. It depends on the person. It depends on how long that pain has been there. But you could literally have something as simple as breathing, stretching, a massage gun, and that literally could take care of the pain. But if you take a medicine, that medicine is going to shut that pain nerve down momentarily, but then cause other things that you don't want,
yeah.
right? Now your liver has to process that medication. Well, what does that do to your liver? And et cetera, et cetera, et cetera.
Yeah. So your hope, your goal with your practice and this direction you're moving in is building that insight instead of just, hey, let's bring this pain down. It's let's help you understand what you can do with your body to feel better and be efficient.
100%. And that's why I called my business School of Movement. I don't want to give you an exercise and you be on your way. I work with people that are like that. And I
Mhm.
actually like to ask in my evaluations, I say, do you want the long story or do you want the short story? So that helps me figure out, does this person just want to be given an exercise? And if that's their MO, that's fine. I can usually plan to be seeing them again in about 6 months or a year because that exercise isn't going to keep their pain
Mhm.
away. But the people who want the long story, that's what I'm here for, is to teach you this is how your body works. All you need is this, or this, and that should take care of your pain. And you can do this with as minimal effort as possible, as minimal as cost as possible.
Yeah. Okay. If you're okay switching gears, I would love to know more about the PRI work that you do and what that might look like in your practice.
Mm-hmm. Yeah, that's a good question. That's a tough question. So I'm gonna try to simplify.
Yes.
So yeah, it's complex. So postural restoration is two. I
Mhm.
think there's about 12, maybe 13 courses. I've done sort of 10. I've done nine, and then they did a free webinar that was like 8 hours long. Um, and in the coursework, they're splitting things up. So the first couple courses, they talk a lot about the muscle system and how muscles pull on the skeletal system.
Mhm.
And they're trying to coordinate your respiratory system with the muscle and skeletal system. So when you get someone that says like, "Hey, I have low back pain," A lot of basic conventional physical therapy will be centered around core strengthening, as if the muscle that's, holding your spine up, as if it's weak. You have to go in, you do this exercise, you strengthen it. Whereas PRI is going to assess you and say, oh, I see that your back is having pain because the position of your rib cage, your spine, and your pelvis, they are not stacked. So the muscles around your back are holding you up too much. Whereas other muscles that actually attach to your back, like your hamstrings, they're not turning on first or enough.
Mm.
Well, how do I position you to find those hamstrings and have you breathe so that the hamstrings pull on your pelvis, which then helps your core pull on your rib cage? So now your rib cage and your pelvis are stacked. And I'm going to have you train your breathing mechanism so that the rib diaphragm and the pelvic diaphragm, which are now stacked, can pump together. Because I want those diaphragms creating so much internal pressure that the body experiences a stretch during an inhale and allows all the muscles to recoil on the exhale. So now I've established a muscular system that can protect a skeletal system instead of that back muscle holding up my whole body or smushing my spine because it's independent of 699 other muscles.
Yeah. So, not just, like you said, it's not just posture, but the engagement within that posture so that you can breathe and function in the best way possible.
Basically, yes. It really comes down to sense. So during my evaluation, during my treatment, I'm asking questions. I'll give you an example. One of the tests that we do is the position, the patient is on their side, laying on a table.
Okay.
And I ask them to lift up their leg and bring it back. And as they move it, I ask them, are your hips stacked? If you're lifting up your right leg, is your right hip on top of your left? Sometimes, maybe, we could say 50-50 as a loose example. 50% of the time, the person can't sense that. They
Mm.
don't know that their pelvis is rolling backward while they're trying to move their leg backward.
Mm-hmm.
So when you're saying about like, can the brain and find the body? That's exactly it. But we're choosing specific positions to get airflow or rather air pressure into places you weren't familiar with.
Okay.
And in this process, we're getting turn on. Yeah.
Yeah. I was gonna say, as a dancer, because I did contemporary for a while and now I Latin dance, um, having body awareness and the ability to know, square your hips, and then actually physically making sure, just as a mental check-in, that they are in fact square. Or like right now, I fall out of my turns if I do more than a double spin. And
Mhm.
I'm noticing that my pelvis isn't neutral. I'm not engaging the core properly when I spin. And when I'm following, it's almost like the pelvis tilts into the turn instead of keeping everything neutral and straight.
Okay. So I love that example because that helps us bridge kind of what PRI is with a person that may have a mild condition, whether it's pain or maybe they're just developing some kind of disease like multiple sclerosis. Maybe they're early stages versus someone that's had it for 20 years. Maybe they have Parkinson's and it's more severe, or they have multiple sites of their body that have pain.
Mm-hmm.
Well, first of all, do you have pain?
No.
Okay. So you just explained that you try to dance, and when you get past your second turn, you lose the connection in your body.
Mm-hmm.
So now imagine if you had Parkinson's. Now imagine if you had a shoulder pain and a back pain. That's a lot harder for your brain to track where those things are, but especially during dynamic movement like dancing.
Yeah. And trying to keep track of everything at once. My
Exactly.
brain keep trying to empathize with that of, oh, well, if I have this pain, again, that alarm bell's going off, which means it's harder to pay attention to everything else.
And then now, more so on your side, well, what does your mind, and you can clarify the terminology for me because I don't have, the sharpness you do. Well, what is your mind telling you that you are experiencing pain and you cannot do the task that you either used to be able to do or want to be able to do? Now you've got psychological stuff going on.
Yeah. So there's two different terms that I use with that. Within acceptance and commitment therapy, we call it fusion. You are fused with the experience. You could be fused with a thought, fused with an emotion, fused with a body experience, but it's kind of like you can't see anything else outside of that. And you
That's
want
so
to what?
No, I said that's so funny because we would call that patterns. You're stuck in a pattern.
Yeah, well, that too. It's like you're stuck in a pattern, but you're fused with it, and you want to build awareness and space from it. So, diffusion, so that you can
Mhm.
look around it and not just see only that.
Yeah,
Um,
yeah.
the other way that I've described it is through EMDR work, which actually does a lot of polyvagal theory too. So there's some overlap there, I'm sure, with what you do. But this idea of being in or out of your window of tolerance. Can you tolerate whatever distress, disturbance, discomfort you're going through and see it as its own separate thing from you? Or if you've lost your window of tolerance, it's almost like everything different is going to go over your head. You're not
Mhm.
going to notice. You are going to be unable to tolerate whatever it is you're going through.
Yes. Yes. So yeah, I think, you and I are in the same camp. Like we're treating somewhat similar conditions. There's a lot of overlap. And in my world, the more the person is in a stressful situation, the brain will rely on old patterns. And
Yep.
correct me if I'm wrong, but it's like you're saying that when a person's in stressful situations, the brain's relying on fusions, like it's its go-to.
Yeah.
And
It gets fused into the pattern and it can't see anything else.
right.
Hmm.
So that's what PRI is trying to do is it's trying to unlock that fusion. It's trying to unlock that pattern. And it's trying to create not just for the ability for your brain and your body and everything to just function, for it to work, but it's also in my world, it does help your brain be in a calmer state. So then when stress arises, it doesn't resort to, well, again, what I would call a pattern, but now it can actually critically think through the process. You don't blame yourself as much, or you don't resort to external things that may not be that great for you.
One, something that's coming to mind for me is one of my favorite, like, beginner therapy tools if that fusion happens a lot or people lose their window of tolerance is just the simplest idea that you are not your thoughts.
Mm-hmm.
When you're in pain or discomfort or struggling with something, there's often all these automatic thoughts that come with that pain. Like, this will never go away. I'm not going to get better. I'm not going to be able to do the things I love anymore. It's like this identity shift that happens. And if you can separate it of, oh, I'm not my thoughts, and you
Mm-hmm.
have the thought of, I'm never going to be able to function again.
Mm-hmm.
Well, if you can recognize it as not you, then you can actually question it, build curiosity around it. Is that true? Am
Mm-hmm.
I completely hopeless now? I'm never going to be able to function again? Well, probably not, as long as you're putting the effort in, going to Brandon's practice. Um,
Mm-hmm. Yeah.
but it allows for you to question whether or not the thought you are having because of that distress is accurate or not.
Yeah. So would you say that you're kind of helping a person build new framework?
Mm-hmm.
Yeah.
Oh, yeah.
Yeah. Love it. So yeah, so I mean that's what we're trying to do is really get that new framework because I think the more that you're in pain, I think it becomes very easy to falter into self-blame or bad decision making. But I don't like when people say that it's normal.
Mm-hmm.
Everyone says, well, my neighbor has back pain, my wife has back pain, my son has back pain. It must be normal, so I'm going to accept it.
Yeah.
And then no matter what you do, whether it's conventional physical therapy, whether it's EMDR, whatever it is, you're still like leaving your progress on the table because of your framework.
Mm-hmm.
So
It's only normal if you decide it is.
yeah, I
And if
feel like
you,
I was gonna say I feel like I want you to see my patients when I'm done with them. I want to see your patients when you're done with them. So they're like the ultimate human. Like everything just works.
yeah, now that you know, have this mind body awareness, you can check in with what your body is doing. Now go to Brandon and he'll make it just as efficient as possible.
300 pounds, like it's nothing, even if that's not your goal.
Mm-hmm.
But yeah,
My gosh. I started strength training and weightlifting just so I could lift my 100-pound German Shepherd.
does it work?
It did. I was able to lift her through as she got older, which was amazing. And now, she's not alive anymore. So I only
Oh,
have this 80-pound dog. It's so much easier.
okay, okay. That's another way to work smarter, not harder.
Yeah, just get
That's
smaller
cool though.
dogs.
Well, that's cool that you trained for that. You had a functional goal. You went out, you figured out how to do it, you made it happen. That's cool. I think a lot of people don't even go down that path because, pain is normal or they don't know where to start. So I think that's really cool.
Well, and I don't know how much you and I have talked about my past injuries because I've blown out my knees several times.
I don't
Um,
know that.
my the doc I went to said that the way that my I can't remember femur, the long bone in the thigh, right? I don't do a lot of anatomy. The way it connects into my knee is at an angle. And so if I don't continue to strengthen the muscles around the knee, my bone basically pops my patellar out.
Okay. Okay.
And so as you know, I lose track of weight of training and I get weaker and then I try to go back into it without strengthening first. I have a higher
Mhm.
likelihood of popping my kneecaps out, and they've popped out 3 times because of that before I knew what was going on.
Wow. Well, that experience has been fun. I haven't had that, but I've treated a lot of people with patellar dislocations or kneecap dislocations.
Yeah.
So, if I may, I'll paint a picture. When you go to conventional physical therapy, especially for a kneecap dislocation, the the PT, the practitioner, is going to really work on strengthening the muscles above and below the knee
Hmm.
so that the femur bone and the shin bone have a better relationship.
Okay.
Okay. So if I were to do a PRI assessment, I would identify how well, again, your diaphragms, the rib and the pelvic diaphragms are pumping together because the pressure when they pump together makes all the muscles feel a stretch and a
Hmm.
compression. Well, what happens in that process, especially if it's working well, is that all the muscles can organize a hip joint so that the hip is centered in the socket. Now, that hip is the femur. So, if the femur is centered in the hip socket, all the muscles around the knee should be able to better coordinate, especially with the shin bone and the foot. And I find that patellar dislocations typically occur because the pelvic diaphragm isn't creating pressure in all the muscles around the hip to keep it centered. So you're going to see things like IT band syndrome, hip bursitis, labrum tears, and those will also lead to patellar dislocation. So it's really what's going on in the core, and can
Hmm.
that core organize well enough to drive the extremities, the arms and the legs?
Yeah.
Again, in conventional physical therapy, they're just looking at the muscle above and below, not the
Yeah.
trunk, not the hip.
Well,
So,
and I learned through that, and I'm sure if you did an assessment on me, you'll find a whole other slew of things because bodies are bodies. But I found that my posterior chain was very weak, especially in the glutes.
okay.
And as I've been strengthening that, I think my last dislocation, I had like a bunch back to back, and my last one was 2017. And it caused tendonitis for 2 years. It
Kind of
just
nice of
didn't,
what?
of the patellar tendon.
Okay. So
And
you hit, but the knee was still having trouble.
the knee was still having trouble, and it would flare up randomly. And it's like I'd be fine. And then I just couldn't do stairs that day. And so in that, I started learning a lot more about, proper posture and proper walking and making sure that not it wasn't just the stuff directly above and below, but also like the rest of the chain was getting strengthened.
Mhm.
And ever since meeting Elliot as well and meeting all these PTs, I'm learning so much more. But what I find is if I take a break from running, I make sure I go back in and work the rest of it for a while before I go back, like come back after a break to ensure
Okay.
that everything is strengthened and like my core is good. And I'm not just, oh, I feel fine. I'm going to go for a run. Um,
Mm.
and it's like
So
all
you're,
this extra stuff.
yeah, you had to do a lot of extra work to get everything tuned up, right?
Hmm.
So first and foremost, I want to say that your work, it worked for you to some degree. So
Hmm.
I want to make it clear that conventional physical therapy can work for people.
Yeah.
I just find that it works best for people with minimal pain. The pain is mild. The pain is in one location, not multiple.
Yeah. And that is
And
definitely
with,
my case, right? It was a singular injury. And I'm very much a lifelong learner. I'm like, what can I do to get better? What can I keep working? I did my yoga training. I have so many breath books in my room right now. Like
yeah,
I have one issue and then I expand as much as possible so that I can continue to function to the best of my ability.
that's an awesome point too. You're asking me about PRI, and PRI makes it a point to say, what we strive to do is to help you function without effort. Things should just be
Mhm.
there. They should be tuned up, and you should have as minimal strategy as possible. You don't need, a ton of things, but they stress to people that it's usually more beneficial people who are like you, They want to learn. They want to know what's going on. They want to take, read this book or read this book to figure out what missing links are missing so that this problem just goes away. So that's PRI is very appropriate for the critical thinker, the nerd, if you will. I very much pride myself on being a nerd and wanting to know more,
Back
wanting to know
at
this
you.
puzzle. Yeah. So with your approach, it was really good, but you made the muscle help another muscle.
Hmm.
Whereas your respiratory system can help the muscular system, help the
Mm,
nervous system.
interesting.
So that's what PRI is trying to do is get all these systems to integrate so that you're a functioning Anna, not even a body, but an Anna because an Anna has a mind and a body.
Yeah, it's all of me, that whole mind body connection.
Exactly. So in that process, you're sensing pain and you're sensing, okay, well, I strengthened my hip and the knee feels better, but now the knee has patellar tendonitis. Well, the muscle system isn't working as a system. The
Hmm.
muscle system's not working with the skeletal system. So strengthening the muscle or the posterior chain, it just wasn't enough for your brain. It needed more connection.
Yeah.
So that's what PRI is doing is what
Mm,
positions do we need to get you into so we
yeah.
can send air pressure to these places that you haven't felt. And in that process, muscles are going to figure out how to work together.
I love that. Um, Also, I want to bring it back to something you said at the beginning of kind of your journey, which is that diaphragmatic breathing. Because, I mean, you made that very key point of I thought I knew what it was. And then I
Mhm.
got tested for it and I realized I didn't really know what it was.
Yeah.
And I'm curious if you'd be open to maybe talking about not necessarily the difference, but what is diaphragmatic breathing and what is so key about it?
Diaphragmatic breathing, in my definition, is that the diaphragm muscle, which is inside of the rib cage, kind of looks like the shape of a tent, that has to descend with the pelvic diaphragm. The
Hmm.
pelvis itself, I call it kind of a bowl because of its shape. And your actual guts, your organs sit in that bowl and they sit on top of the pelvic diaphragm. So when the rib diaphragm and the pelvic diaphragm are stacked, the rib cage is on top of the pelvis. Those diaphragms pump together and they create a pressure in your entire body. There's a pressure change in your abdominal cavity that takes care of the guts. There's a pressure that pushes on all the muscles, so your brain knows where the muscles are. Even within the guts, like we'll use the intestines for an example. With an inhalation, the intestines will actually stretch out too, because there's a pressure in the sphincter of the intestine. So all these systems rely on pressure for passive function. Where I was trying to belly breathe, if I inhale, does that belly stretch out? If I exhale, does the belly contract as well as do the other muscles contract?
Hmm.
If I get two diaphragms to pump on an inhale, the belly doesn't stretch out, all the muscles stretch out. My back stretches out, my calves stretch out. Your feet have four layers of muscles on the bottom. So those four layers of muscles stretch out. And if I was breathing better, you wouldn't see all these pathologies like plantar fasciitis and impingements, right? Where things are too compressed. They're not getting expansion from inhalation. So that's really what diaphragmatic breathing is can you get a good pressure sense in your body that's not just limited to your belly?
How how do you teach that? How do you instruct someone through to do it properly and building that pressure versus just in and out?
Yeah. So for those that can't see, I'm not on camera, but for those that really want to see what this looks like, look up sway back posture. And a sway back posture, simply put, is a rib cage that is rotated backward and a pelvis that's rotated forward. And remember, the rib cage diaphragm and the pelvic diaphragm have to be stacked. Well, from what I see in practice is that 99.9% of us have sway back posture, which I'll get into a little bit more as to why. But the rib cage and the pelvis, they're pulling on those diaphragms, so those diaphragms can't pump together. So because most people have that sway back posture, the rib cage in the back is actually sunken in. So what I do with people is I'll place my hands on their back and I'll give them a tap repetitively. And that tapping is both pressure and vibration sense. So they sense that
Mm-hmm.
location. Once they have a sense of that location, I cue them to inhale through their nose and guide that airflow to my hands. Now that airflow could be guided toward a table if they're laying on their back. It could be
Mm.
guided toward the back of a chair if they're sitting with a backrest, et cetera, et cetera, et cetera. So the inhale should be guided to the back side of the rib cage in a way that makes their rib cage rotate back down so it's stacked on top of their pelvis.
Okay.
And that's just the inhale. Now that the body has somewhat of an expansion from the inhale, the exhale is going to cause all the muscles to compress, especially when the rib cage is pulled into a more neutral position instead of rotated backward in that sway
Yeah.
back posture. So that's really where I start is getting pressure to the back of the rib cage.
Hmm.
Does that
Yeah,
make sense?
that does. My brain is running wild with other theories from my side of the body and mind. What came to mind for me there is this EMDR theory of everything we do is adaptive. It
Okay.
is, which means at some point in your life, you needed to do it that way to help you through,
Mhm.
right? So if somebody got an injury on the physical side, maybe until they can get to a doctor and get it fixed, they have to lean in a weird way to be able to move,
Mhm.
right? But then if you get stuck in it, even if as things heal, you might still be leaning in that way or having your balance off separate at some in some way because previously it needed to be that way. It's the
Yeah.
same with mental health. If something is really triggering or upsetting or difficult for you, it's usually a sign that at some point you needed to respond that way in order to survive.
Mhm.
It's the same for like if somebody dissociates. But if somebody comes in and they're frustrated that that's their response system, it's almost a sign that they've healed enough that they no longer need that pattern.
Okay.
And
With
so yeah, my brain was connecting to like adaptive patterns and like how it was versus how it can be. Your body wants to function. Its job is to help you survive. And
Mhm.
ideally, it wants to do it in the most effective way possible, but it might not know how to, or it might be stuck in a pattern where it can't anymore. And what we notice through EMDR is if you kind of dangle the adaptive pattern, like the better, more effective way of doing it, your body's almost like, oh, thank God, can we please take this instead of
that.
how we've been doing it for so long?
Yes. You really feel
Yeah.
that release. Like it's like, wait, this is so much easier. Yeah.
Yeah.
So I first of all agree, and I really like what you said. I want you to interject if you feel like there's something missing in the connection I'm trying to make.
Okay.
So, we were talking about conventional physical therapy versus maybe someone needs a deeper dive.
Hmm.
So let's say if someone is in the camp you're in, you have one side of pain, the pain is mild. It hasn't been there that long. I know it's been there for a couple of years, but it hasn't been there for that long, like 30,
Well, and
40
I'm
years.
good now, right? So
Yeah, and
no
you're good
pain
now.
anymore. But yes, at that time. Hmm.
Hold your breath. Wait to see what happens when you get up from that chair. That's last word. So because you're in that setting and because you're younger, physiologically you have larger reserves. So think back to when you were 5 and you fell off a bike. It really hurt. You scraped your knee and it was bleeding everywhere. You're crying your eyes out. And maybe like 2 hours later, you're back on that bike,
Yeah.
right? You have larger reserves. So you can
Hmm.
damage tissue and your mind can be upset, but your reserves allow you to get back on the horse, so to speak, pretty quick.
Yeah.
So when you talk about maybe someone that's 15 or 25 or even 35, and maybe they go to a chiropractor and get adjusted, or they go to see a conventional physical therapist and they get dry needled, the hope is that that intervention unlocked the pattern enough so that your brain, your physiological reserves, whatever it may
Yeah.
be, can coordinate that injured part now with the rest of the body without additional intervention. Is
Yeah.
that kind of what you were saying?
Yes, I agree with that. And also, it's the same on this side of ideally, you're going to figure it out on your own. And your body will find that adaptive pattern and then be able to let go of it. And this is polyvagal theory. So, the polyvagal ladder of you have, ventral vagus where you're in your safety system, then you maybe something happens and your sympathetic nervous system gets activated. You're in that fight or flight. Or you need to go into kind of dorsal vagus. You have to shut down, you have to freeze, you have to numb. The way it works when it's functioning as efficiently as possible is you can hop up and down that ladder for whatever you need.
Yeah.
It's when you get stuck in
Yeah.
sympathetic or you get
Yeah.
stuck in dorsal and you can't find your way back to safety that you then need intervention. You're stuck in the pattern and your body doesn't know how to move through it to get back to where it wants to be.
100%. I have so many things I'd love to speak to that.
Okay.
Stop me at any point. So I 100% agree with you. It's like you get stuck, you need some extra help. So in my world, whether that's PRI or whether that's just physical therapy or just my experiences, when you get stuck, especially if a system gets stuck, I might need to take you to a dentist and I might need to get you a mouth orthotic to help you align your jaw with your head
Mm-hmm.
so that your tongue can relax, so that your airway can open. Now, someone might have pain and they might get away with a conventional physical therapy exercise or chiropractic adjustment and they're not stuck, right? That's
Mm-hmm.
great. But now we're dictating, well, can this person recover or do they have to compensate?
Yeah.
So what you're saying is I live in that world too, but what you're saying is or in my world rather, how much recovery can they truly make? What interventions or outside help do we need to get them as
Mm-hmm.
close to recovery as possible and steer them away from compensation? So now we're just going another layer of the onion. We're just peeling another layer back.
Yeah.
But if you factor in, well, now they have a neurological disease, they have Parkinson's. You can't fix that.
Mm-hmm.
Not with the technology and the evolution that we're at. You can't fix that in these times.
Yeah.
How much recovery versus compensation can I get them, even though they're stuck? So these are the thoughts I was having as you were saying that.
Yeah. And also that piece around acceptance, right? Your
Yeah.
body isn't the same as it was, and it might never be. But that doesn't mean we can't help you figure out how to adapt to this new body, how to accept the new identity that you have to figure out how to live with.
And I'm so glad to leave that to you.
Yeah, I've got that part covered.
Yeah.
The identity part is hard. And having gone through chronic pain and random injuries, and fortunately been on the other side where I have made a ton of progress and I'm not really plagued with it anymore. But there has been a lot of identity shifts and recognition of what my values are and what I'm willing to adapt with and what I'm willing to fight for,
Mm-hmm.
right?
Mm-hmm.
Um, and there's so much understanding and as you said, layers to all of this.
Mm-hmm. And the answer is always it depends. Every
Yep.
case is different. So let me ask you this. So in the PRI world, I assess you, and the assessment tells me what pattern you're in. Are
Hmm.
you favoring the right side of your body? Are you favoring both sides, but in a compensatory fashion where the neck and the back are really doing too much work to hold you up?
Hmm.
And based on that assessment, those patterns, I give you two, three, or four interventions that help you reprogram to help you unlock those patterns. So pain calms down. Like you were saying with sympathetic and parasympathetic, you start to regulate those a little bit, helps
Hmm.
your mind stay calm. But every time I get to see you, I get to reassess you and hope that you did your homework and now you're in a better pattern. So now I get to progress you to not a supported technique, but now an unsupported technique.
Hmm.
Supported, we're trying to get certain parts that were shut off or not doing their job to now pick up the slack. But now, can all the parts work together in an unsupported fashion? So now my question to you is, to better help my patients, to better help direct my patients to counselors, specific things like EMDR, I would imagine you don't alter the things you give them to work on, unless that's not true,
Oh,
versus other.
completely.
So you do alter.
Oh, yes. And the cool thing about EMDR that I love is there's tons of different protocols depending on the need. Like there's the traditional one, just clients coming in, this is very standard. We don't really have to change much. I have
Okay.
protocols for chronic pain. I have protocols for just they're feeling too much.
Mm,
And like there's too much fear and they need to bring the fear down. I
okay.
have and I can also change the script within EMDR to allow for more play with the body
Okay.
and the nervous system versus like this is very constricted.
Yeah.
The metaphor I use to describe that is like for anybody that walks dogs, there's different types of leashes.
Okay.
So in full EMDR, eye movement desensitization and reprocessing, it is like I unclip the leash and I just let the dog run wild. And occasionally they come back and check in with me and I see where they're at. But it's like you go wherever you want to go. We're just going to see where your nervous system takes you.
Yeah.
Then, if people need a little bit more guidance, it's EMD little r. It's like I
Okay.
put them on a leash that retracts, where it's like they can kind of go off, but then they're always connected to me and they come back. It's like, check in where you at.
Yeah.
And then at the most constricted form of processing, it's like a non flexi leash where they clip in. They are basically in a perfect heel next to me. And anytime they look off, I'm like, hey, come back.
Okay.
And what that does is if somebody has horrible chronic trauma or gets really triggered really easily, that constant check in prevents them from getting out of their window of tolerance.
Yes, I'm with you.
And it's not perfect,
Mm.
but it does help. And I get to play within that. I'm also, because I do acceptance and commitment therapy and I do a lot of somatic mind body work and I do a lot of parts work, I can incorporate that. They're called interweaves through that reprocessing versus I just stay on this script at all times. Like if you're feeling this need to like push something away in the middle of session, well, I'm going to put you up against a wall and make you push because that's what your
Okay.
body needs to work up and down that polyvagal ladder.
Yeah. I'm just sitting here thinking like how cool it would be to co-treat a patient where like let's say you're talking with them and you're doing anything that you find appropriate and I'm watching their body. Like you said, you see their body trying to push back, so you'll have them go physically push.
Yeah.
Well, while you treat them, I'm watching their body and their postures, their positions, what's getting more tense
Mm-hmm.
or giving up tension, and then
Yeah.
saying, okay, I think you need this technique or these adjustments to complement
Yeah.
what you're doing. And then vice versa. You're sitting on a session watching the patient adjust their body and reposition, and you're
Mm-hmm.
watching their mannerisms and their body itself. And then you take them on the road and say, well, like, hey, try this now. And you enhance what I'm doing.
Yeah. Not just what the experience is, but their reaction to the experience
That
and how
too,
to
yes.
navigate it.
Yeah. So you're diving deeper into their pattern, right?
That would be so fun.
Anytime. Anytime.
We'll have to find the perfect patient that would be willing to play with us with that.
Elliot.
Yes, I'm sure he would love it, actually. Yeah. One thing I always say, which I think you'll love, is it's always easier to practice when you're feeling good
100%.
because then you can start getting used to it and what it feels like. It's going to be easier to tap into it when you're not feeling good versus waiting till you don't feel good and then you're going to forget everything you learned because you're not used to it.
So here, this is based off what you said. So within PRI, and you go into higher level courses look more at the actual cranium, the skull. It looks at the jaw. It looks at the teeth.
Mm-hmm.
And a lot of these structures, it's more about, well, can you sense? Can you get pressure? Like we were talking about before, but in a way that gives your brain a perception of where your body is without even having to use the body. So these lower level courses are more about the body itself and the muscles, and the higher level courses are about more your senses and the positions of your jaw and your neck. And all that's really geared around your airway. Okay.
Yeah.
Because the airway, if it's open, you can get your body. So people that I follow, that I try to learn from, they will use an example of a patient laying on a table in a test, testing position.
Mm-hmm.
And the practitioner, the PT, will play a song that the patient likes, and they will test negative. So that song is giving their brain a sense of peace or familiarity or whatever it may be that unlocks the body from guarding. And they
Mm-hmm.
will test negative, which is a good thing. Then they'll put on a song that they don't like, and all of a sudden they test positive. So
Because
literally
everything tenses up.
everything tenses up. So literally the condition matters. How many people are in the room? How loud is the music? How bright are the lights? What
Mm-hmm.
happened before your workout?
Yeah.
Well, it was just kind of making me think about that what you were saying, but all these things matter, and you can get a completely different response just based off one little thing you would never even thought of.
Mm-hmm. Well, and building that awareness of everything is okay right now can be so key in letting those barriers down and relaxing. I did this in a previous episode. So, those of you listening, go back and listen. Um, but it's this idea of building a nest where you check in with your space and it's just this awareness of, am I safe? Like,
Yeah.
do I need to add a blanket? Am I cold? Do I want a jacket? Do I need my water? And then checking in, like, how is my positioning in this chair? Do I want to resituate the mic so I'm more comfortable? Am I good? And then it's the internal awareness of, how am I feeling right now? Is there anything I can do to feel safer?
So I have a question. So let's say you get a patient, and obviously the answer is it depends. It
Of
always
course.
depends. But what is like a go-to piece of advice if you can offer that
Mhm.
when someone has a pattern or a fusion that says, I recognize I'm uncomfortable, or I recognize I'm stressed, I recognize I'm anxious, but I don't want to adjust.
Yeah. Well, it's a great question. From a theory side, I don't know if I'd necessarily say it explicitly to them unless I have a really great rapport. There's that idea of adaptive, right? If they don't feel comfortable letting go of the discomfort, that means that their body has taught them that the discomfort is more safe than the
Hmm.
comfort.
Hmm.
And so, what I would do there is I'd almost normalize that you don't have to let go of all of it. It's okay right now to do that. Is there anything we can do, maybe not to turn it off, but to maybe lower the intensity? Can we do like a dimmer switch here? Can we
Okay.
bring it down 5%?
Yeah.
What is the most uncomfortable thing here or the least uncomfortable thing here? Your feet are cold. Let's put some socks on. You feel like
Yeah.
I'm too close to you? I'll back up a little bit. Like, if you
Yeah.
can just change one small piece to bring the discomfort down, even just a tad, the next time you meet them, they're going to feel a little bit better and it'll
I like
just build over time.
I like that because we deal with that too in the PT world. Like
Mm-hmm.
I've had patients where they're so comfortable in their pain
Yeah.
that it's almost a threat to try to let go of that and find a new position or posture
Yeah.
because they're just so comfortable in that.
Yeah. And
So,
it's the same with trauma, right? If you have chronic trauma, that
mhm.
is your normal. And
Uh,
anything that could be more comfortable or safer feels terrifying because you have
yeah,
no context for it. You don't
yeah,
know what to expect.
yeah. And it's funny because like an outsider would be like, "What are you scared of?" And the person going through it's like, "This is the biggest thing," you know.
Yeah.
You never
This
know.
this is scary.
Yeah. One of the things my mentor showed me is that she we ask questions about everything, your history, your office setup, how you're spending your time in your body. Like, are you standing
Mhm.
more, are you sitting more, whatever. And she says, put a water bottle that's bright on your left side. So if you're working at a desk, you can't get up from work, right?
Yeah.
You put a water bottle on your left because the patterns we're in drive you right. Well, I'm not going to make you get up. You're busy, right? So I'm going to change one small thing. I have a bright blue water bottle. It's more to the left of me. And we can get into the science of the patterns that we're in,
Yeah.
but you're missing left periphery.
Mm.
So your brain is guarding your body more because it's unaware of what's in your periphery on the left.
I'm curious if that's different if you're left-handed or ambidextrous or if that is across no matter what.
The only reason I hate that question is because I haven't gotten into the science yet. That's on my list of things to dive into.
Well, let me know when you find out because I'm left-handed, so I typically reach left a lot. But I actually have my water bottle on my right, but then a bunch of really bright fidget toys on my left that I grab a lot when
Okay.
I'm in session.
Okay. So here, I'll give you what I have, and if you have stuff too about
Yeah.
being ambidextrous versus righty versus lefty. So what I have is that the diaphragm on the right is bigger. There's a liver underneath it that
Mm,
shaped that right diaphragm to be broader and sit higher up. I don't know why, but the right diaphragm is made up of more muscle rather than tendon.
interesting.
And tendon doesn't contract, muscle contracts. So the right diaphragm is more muscular than it is tendinous. The
Hmm.
left diaphragm is more tendinous than it is muscular. The left diaphragm has a heart on top of it, so it sits lower. And it's also smaller in size because there's not a liver underneath it.
Interesting.
Going a little bit further, the way that the brain connects to the body, you may know this, is that the left side of the brain actually wires the right side of the body.
Hmm.
Remember the right side of the diaphragm is bigger?
Yeah.
Well, The left side of the brain, which wires the right diaphragm, the left side of the brain has the speech and language center.
Hmm.
So that left brain has to be able to help you talk, and talking is exhaling. So if my left brain connects to my right body where I have a bigger diaphragm, another purpose of it being bigger is so I could talk better.
Huh. That's fascinating.
But if that right diaphragm is bigger and it has more leverage to pump more pressure, it's pulling us to the right side. That's why most people are on the right leg.
Yeah, that makes a lot of sense.
And in that right pull, where you're shifting over to the right, now you're taking in more left central vision and right periphery. You're not taking in left central and left periphery. Or, I'm sorry, right central, left periphery. So these patterns are driving every sense of your body. Your visual system has changed, your auditory system has changed. You're going to hear with the right ear better than the left if you're on the right side of the body. The right
Hmm.
diaphragm's going better. And even furthermore, your feet are a sensory organ. So if you're more on the right foot, your right foot's giving your brain information more so than your left foot. So now your sense of your body is altering to a sensory integration level. Left eye, left ear, left diaphragm, left foot, they're not giving the right brain enough information. So now you feel more threat when on the left side at a subconscious level, and you want to get off that left side. So now you're exacerbating the paradox.
The body is so cool.
All right.
And I'm
Both
also
people can work.
I'm trying to be cognizant of the time. So I think maybe I want to have you back again in the future to talk just probably solely about breath and the diaphragm. I think that would be very cool. But I also wanted to ask you some questions about your business itself.
Sure.
One for just people that are listening that might want to know, but also in building insight and the journey. This is your journey.
Mhm.
And I would really love to know where you're hoping to take this. Like in an ideal world, what are you following here? What do you want to build?
I appreciate that question. This is more based off my background, my experiences, my upbringing, is that the way that I'm wired, I just always found that I like to bring people together. I was that guy that had, this friend group and that friend group and that friend group, but I want all the groups to come together.
Yeah.
Because I always imagine that when the right people come together, I want to know what can we create? What can we joke about? Like how far can we take the joke? What can we actually create, in real life that's tangible? And how far can we take that? So my end goal really is to have a space that is a combination of a physical therapy clinic, a gym, because I'm still a trainer, but also a classroom. And within that, I hope to have around 15 to 20 people that are on my team where there's a massage therapist, there's a Pilates instructor, there's another physical therapist, there's a chiropractor. So when you walk into our building, not only do you feel welcomed, we want you to feel that you want to be there, but that you can get the help from the best team that works together at a high enough level that we help you immediately. And you want to keep coming back and you want to learn more, but you also want to hang out after your workout and sit there and play Xbox with us. And in all honesty, that you stay back and play tetherball with us. I want a tetherball in my gym, but I want to create a community where people want to be, see what we can create together. So that's where I'm
Yeah.
going to take this.
And continue pressing those boundaries of what we know because there's always more left to discover.
100%. 100%. I try to really be humble because I think that there's a ton of information out there. I think that some people can put this together better than me. So I really try to be humble. But yes, I want to help kind of override what people think is normal.
Yeah.
It's not normal to be in pain. It's not normal to have to go back to conventional physical therapy every 6 months or every other year. That's not normal.
Mhm.
So, yeah, well said.
Yeah. Well, and my biggest guiding value in all the work I do is curiosity. Because it's the same thing. I feel the more I know, the more questions I have. Like, oh, I learned about this thing. Well, now I want to learn about these 10 things related to that. Like
Yeah,
there's education and learning never ends unless you decide you're done, which I don't think I ever will be, which is why
I
you and I get along so well.
totally agree. And I'm sure you've experienced this too. It's like you might have a session with a client or a patient. They might say something and that sparks something in you to go research or figure out, You know what I mean? So then you can help that person and 10 other people better.
Yeah. I
So
actually keep notes up on my computer and just keep a list anytime someone mentions something.
love it. Love it. I've got that scattered through my notepad. I probably got like 50 of those notes. Not as organized as you. But yeah, no, I'm with you.
Well, you're not remote like I am. I get to have my notes on the left and the people on the right and do whatever I want.
I have to kick. We have a treatment table in my gym. So I treat out of a gym, and the gym itself has 5 separate rooms. I have to kick the personal trainers and their clients off the treatment table so that they don't use the massage gun on their patient, and rather I have to use the table to do physical therapy. So yes, I'm battling some people for some
Yeah,
equipment.
you're constantly juggling spaces versus like, this is my space. This is where I work. I don't do anything out of it unless very rarely I'll meet people in person at a park somewhere and walk around for an hour.
Right.
Um,
Right. And it just kind of happens.
yeah. Okay, so I've got two more questions for you. These are the wrap up questions I gave you. But before we do that, I guess I should check in. Is there anything else you feel like you really want to mention today, or something we didn't really talk about that you want to be able to bring up real quick?
You do this in your practice too, but my biggest thing I want people to take away is that when you can get your diaphragms to be stacked to where they're breathing better and the neck muscles are not leading respiration,
Hmm.
you're going to be so much calmer. It really regulates your sympathetic nervous system. So you're not in that fight or flight. And that's the biggest thing about stress is in my world, you got to be able to breathe right so that you can actually critically think. You can be calm. You can enjoy your day. You can work through problems and not falter into bad decisions.
So, the key piece to walk away from today is stack your diaphragm and don't breathe with your neck muscles. Actually, breathe with the muscles meant to breathe.
Especially less is more. If you try really hard, you use a lot of effort, that pattern, that neck is going to take over. So less effort, quiet, concentrated breathing. Yes.
Yep, you need to come back on so we can just spend an hour talking about breath because I think there's a lot more here we haven't gone into.
Here for it. I'm here for it because we got to talk about how the diaphragms actually connect to the core muscles.
Yes. Okay. We are definitely coming back in the future. It's happening. I've already
Yeah,
decided.
I
Um,
love it. I love that
so
you tell me what to
then,
do.
well, let's get through this episode first, and then we'll worry about it. I fortunately have a lot of people that have agreed to come on to this. So you're one voice of many, and I want you back, and it will happen. And also, hopefully, everyone else can be just as amazing as this episode was. Um,
Well, I want to actually, I want you to take more time and have me come back later so I can listen to your podcast. And then I get to speak about everything I learned.
that'd be amazing. I'd love it.
That's
Uh,
that.
okay, so talked about the one piece of knowledge. My last question for you for today is, what is an intention or value that is guiding you for this next week?
That's a good question. The biggest thing I think that's in the forefront of my mind lately, and it keeps popping up in different ways, is be present. When
Mm,
I'm in front of people, I can see 10 things I can help them with. I hear 10 things I can help them with and adjust. But if I'm always relying on what my brain is seeing, I'm not really listening to the one thing that that person's showing me or telling me, and
yeah,
I'm 10 steps ahead, I'm not present. I'm not present. And then that shifts my energy, and then we can feel that. And my biggest thing is if I'm present and you feel that my energy is safe, I feel that you're going to be more vulnerable. You're going to respond better to what we're trying to do. You're be more motivated to do the homework without me. Just be present.
yeah. One thing we learned in my schooling is people typically listen to respond versus
Yeah.
listening to listen and then deciding how to respond.
Yeah.
And we got challenged a lot on like, hear what they're saying, and then you actually have to say that back before you get to respond on anything. Not like that's how I do therapy, but when we were learning, because it really challenged us to slow down and hear their words before deciding what comes next.
And it was hard at first, wasn't it?
Oh, yeah, it is so challenging. It is not how we are taught to listen in our world, But if you can actively listen, if you can slow down, if you can be present in that way, it really helps build connection and helps everyone else around you feel heard.
I'm 100% with you. I hate to say this, but I'm almost extremely turned off when you say something and the person responds in a way that has nothing to do with what you just said.
Yep, it's invalidating.
You're not here with me. We're not really connecting. You know what I mean?
Yeah.
I'm with you.
Versus, oh, I didn't think about it that way. Or, oh my gosh, I love that you said that because,
Yeah.
right? It's like, no, I need to feel heard before I'm going to hear you.
And you're missing so many doors. You're missing so many things that would open up. But also, like, I think for the listener too, easier said than done. But how can you be present to enjoy things that suck? Because
Accepting the discomfort.
you can get so much more out of things that you tell yourself you don't like. You know you don't
Hmm.
like it. That's fine. But still, how can you challenge yourself to be present? Because you might actually have a day or find something.
Yeah,
So,
one thing that I don't know if it's going to happen soon or not, but one episode I want to do for this podcast is actually the purpose of emotion
okay.
because it's all adaptive, right? So people hate anger or sadness or grief or frustration, but it's your body trying to tell you something.
Yeah.
And so sometimes I'm really anxious, but it's my body telling me I care about that thing. And so I'm going to let it be anxious even if I hate it. And maybe I have coping skills to bring it down, but I don't actually want it to disappear or numb it because then I'm ignoring the cues that my body gave me.
Wait, it's not normal to go drink a beer instead of listen to my body?
Yeah, no, that, I mean, it's normal,
Yeah.
but
Right.
maybe not the best choice if you're trying to be present or figure out how to move through life and learn what you want versus literally just making choices to avoid.
Yeah.
That's
Yeah.
our natural response as people.
I like what you said. I feel like what you said is becoming, my world is becoming more common. So I love what you said. And I hope that, in your world, I know that that's kind of like something you would probably teach a lot,
Hmm.
sit with it, be present, etc. But it
Yeah.
just seems like it's becoming more common knowledge.
Yeah. My favorite thing is I'll have people come and be like, I just feel really numb, like they are dissociated or they got triggered or whatever. And I'm like, maybe you need to be numb right now.
Okay.
Maybe your body doesn't know how to not be numb. And this is exactly what you need until it feels safe enough to feel whatever it is you need to feel.
Cool. I like it.
Yeah. All right. Anything else you want to add before we end?
No, this was fun. I appreciate you having me on, letting me rant and rave about something I really love, and I find it helps people.
Yeah.
So thank you. Really.
I love that you're able to help people with this because you found your passion, and that's always going to help, no matter
Yeah,
what it is. So, thank you for spending the time with me today. And I am so excited to do this again.
that was good. I am too. Thank you for having me again, and be well.
You are welcome. Okay, bye.
Great day.
Today, I got to nerd out about neurology and the mind body connection, and I hope you enjoyed this episode as much as I did. I truly believe that our minds and bodies work hard to help us survive. We just get stuck in old patterns sometimes that no longer serve us. This reframe can help us be kinder and more understanding to ourselves as we try to build new patterns. Noticing and naming is just the first step, and people like Brandon help our bodies change physical patterns while I work to challenge mental ones. Hopefully, something we talked about today resonated with you. If it did, let yourself sit with that idea for a little while longer. If you have any questions for this podcast or any themes you'd like us to focus on in the future, send us a message on Instagram at Insights With Us Podcast or send us an email at insightswithus@gmail.com. If you enjoyed this podcast and want to hear more, please follow, like, or subscribe. You can also donate on Podbean's Patreon program or find us on buymeacoffee.com. I appreciate you and I appreciate that you are listening. Thank you for creating insight with us.